Hello, my name is Lee YY. I'm one of the diabetes inpatient specialist nurses at Eastbourne District General Hospital. Um, what I'm going to show you is how to administer insulin safely and effectively. So yeah, the first step is to wash your hands. Um, Second is to gather all the things that you require, such as your insulin pen, insulin needles, sharp pin, and also your drug chart. And next is, you go to your patient and make sure that you get his or her consent. Also check that you are about to administer the insulin to the right patient, the right time, the right route, and that you're using the right device, and make sure that the insulin that you're using is in date. So after getting consent from the patient, then you can start the procedure. Okay. It's important to check the right device and the right insulin that you're giving the patient, because it will tell you which site to inject it on. So for long-acting insulin, we would recommend that you inject it to the outer thigh or top of the thigh, and for short-acting insulin, you inject it onto the patient's abdomen. If you've got all your things ready, what you need to do is remove the cap from the pen and then attach the insulin needle. Okay, just screw it in until it feels tight. Okay. And then to make sure that the insulin pen is working, you need to prime the needle or do an air shot. So to do that, you need to dial the insulin pen to 2 units. Okay. Remove the cap and then inject it into the air and push the injection button all the way in until you see droplets of insulin on the tip of the needle. Okay, and then dial the required dose. Okay, and then choose what site to inject the insulin on. If, as I mentioned earlier, if it's a short-acting insulin or rapid-acting insulin, then into the patient's abdomen, and so the angle, so then the should be 90 degree. There's no need, because the needles are quite short and are very thin. There's no need to pinch the patient's skin. So you can just inject the insulin directly at a 90-degree angle. Okay. Remember to allow the dose counter facing you, so that when you press the injection button, you can see that you're giving the right amount of insulin. Okay. And so as you push the injection button, make sure that it goes all the way in, okay, until the injection or the counter points to 0. Okay, to ensure that the insulin is properly absorbed by your subcutaneous tissue, you need to count from 1 to 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Withdraw the needle, okay, and then discard the needle into the sharp spit. Okay. Please don't forget to put the cap back on, as it protects the insulin from sunlight. And the insulin that are being currently used should be stored at room temperature, and try to avoid exposure to sunlight. And also, another thing to remember is if the patient, for example, has been prescribed with cloudy insulin such as Novomix 30 or Insulatard, to remember mixing them first before injecting them, to make sure that the appearance is homogeneous, and that they are uniformly white in color. When injecting, avoid as well injecting to patients' arms, because usually this area has less subcutaneous tissue, and you may accidentally inject it into their muscles, which can lead to quicker absorption of insulin, and they may end up having hypoglycemia. Another thing to remember is when injecting, avoid any lumps or bruised area, as it can affect the absorption of insulin. So I hope you find this helpful. Thank you.